and welcome to this section. We're still on to nutrition for specific conditions, and in this section we'll be talking about hypertension. All right, so we'll be understanding what hypertension is, the role of sodium in blood pressure, and also we'll be looking at the dietary approaches to stop hypertension. All right, so what is hypertension? Hypertension is known as high blood pressure, and it's a chronic medical condition in which the force of blood against the walls of the arteries is consistently too high. Blood pressure is measured using two numbers. Number one, systolic pressure. This measures the pressure in your arteries when your heart beats. And two, we have the diastolic pressure. This measures the pressure in your arteries when your heart rests between beats. A normal pressure reading is usually around 120 over 80 mm. Hypertension occurs when these numbers are consistently elevated, typically above 130 over 80. While high blood pressure often develops over many years without noticeable symptoms, it can cause significant damage to the heart, blood vessels, kidneys, and other organs if left untreated. Over time, it increases the risk of serious health complications such as heart disease, stroke, and kidney failure. Hypertension is often referred to as a silent killer because it may not show obvious signs until significant damage has already occurred. This makes regular monitoring and management essential, especially for those at higher risk due to factors like age, family history, poor diet, lack of exercise, obesity, or excessive alcohol consumption. The role of sodium in blood pressure regulation. One of the most important factors influencing blood pressure is the amount of sodium in the diet. Sodium is a key component of salts, sodium chloride. It plays a crucial role in maintaining fluid balance and nerve function in the body. The kidney are responsible for regulating sodium levels by filtering and excreting excess sodium through urine. However, when there is too much sodium in the bloodstream, the kidneys may not be able to keep up, leading to a higher volume of fluid being retained in the body. This increase in fluid raises the volume of blood flowing through the arteries, which in turn increases the pressure on the arterial walls, leading to elevated blood pressure. Over time, high sodium intake can stiffen blood vessels, making it more difficult for blood to flow freely and further contributing to hypertension. Most dietary sodium comes from processed and packaged foods, rather than from salt added during the cooking. Foods such as canned soups, processed meats, snacks, fast foods, and frozen meals often contain high levels of sodium. This makes it essential for individuals, especially those with high blood pressure or at risk of developing hypertension, to be mindful of their sodium intake. Reducing sodium consumption is one of the most effective lifestyle changes for managing and preventing high blood pressure. Now we move on to the DASH diet. What is the DASH diet? Dietary approaches to stop hypertension. It's an acronym. Yes. Now the DASH diet is a well-researched, heart-healthy eating plan specifically designed to lower blood pressure and promote overall cardiovascular health. It is rich in nutrients like potassium, calcium, and magnesium, which helps regulate blood pressure while being low in sodium, unhealthy fats, and added sugars. The DASH diet encourages the consumption of a variety of whole nutrient-dense foods while limiting the processed and high sodium items. Key components of the DASH diet include: number one, fruits and vegetables. These are the cornerstone of the DASH diet. providing a high intake of potassium, which helps counterbalance the effects of sodium in the body. Potassium aids in relaxing blood vessels, promoting better blood flow, and reducing the pressure on arterial walls. Number 2, whole grains. Foods like whole wheat bread, brown rice, oatmeal, and quinoa are excellent sources of dietary fiber and important nutrients. Whole grains help improve heart health by reducing cholesterol levels and promoting better blood sugar control, which can reduce the risk of hypertension. Number 3, low-fat dairy. Low-fat or fat-free milk, yogurt, and cheese provide calcium, which plays a key role in blood pressure regulation. Calcium helps blood vessels tighten and relax properly, preventing hypertension. Number 4, lean proteins. The DASH diet encourages lean source of protein such as poultry, fish, beans, and nuts, while reducing the intake of red meat and high-fat animal products. These lean proteins support heart health and help manage cholesterol levels, further reducing the risk of hypertension. Number 5, we have the healthy fats. The diet includes heart-healthy fats from sources like nuts, seeds, avocados, and olive oil. These fats help reduce inflammation and improve cholesterol levels, contributing to better overall cardiovascular health. Number 6, limited sodium. One of the primary goals of the DASH diet is to reduce sodium intake. While average person consumes more than 3,400 milligrams of sodium per day, the DASH diet recommends reducing sodium intake to 2,300 milligrams per day, with an even lower target of 1,500 milligrams per day for those with more severe hypertension or those looking for maximum benefits. Number 7, reduce added sugars and saturated fats. The DASH diet limits the intake of sugary beverages, sweets, and foods high in unhealthy fats, such as fried foods, processed snacks, and fast food. Instead, it promotes healthier alternatives to satisfy cravings without contributing to weight gain or high cholesterol, both of which are risk factors of hypertension. Now, how does the DASH diet help to lower blood pressure? Beyond its benefit for blood pressure, the DASH diet also promotes number 1, weight loss. The focus on whole nutrient-dense foods can help individuals achieve and maintain a healthy weight, which is important for managing blood pressure. Number 2, cholesterol management. By reducing saturated fats and increasing fiber, the DASH diet helps lower the LDL, which is the bad cholesterol levels, further reducing the risk of heart disease. Number 3, overall heart health. The DASH diet balanced approach to nutrition supports overall cardiovascular health, reducing the risk of heart attacks, strokes, and other complications associated with hypertension. In conclusion, understanding and managing hypertension is critical for maintaining long-term health and preventing life-threatening complications. Sodium plays a central role in blood pressure regulation, and reducing sodium intake can significantly lower the risk of hypertension. The DASH diet offers a practical, sustainable approach to managing blood pressure through balanced, nutritious eating. By adopting the principles of the DASH diet, individuals can not only lower their blood pressure but also improve their overall heart health and well-being. Now we'll move on to understanding heart disease. We'll go on a short break, and when we return, we'll talk about understanding heart disease. Thank you, and God bless you.